WisconsinEye's Campaign 2024 programming is sponsored by Wisconsin Counties Association, Nicolet National Bank, Wisconsin Hospital Association, Operating Engineers Local 139, the Wisconsin Realtors Association, the Wisconsin Laborers District Council, and North Central State's Regional Council of Carpenters. To support programs like this, please consider a tax-deductible donation at wiseye.org/donate or by texting WisCI to 44321.
Senator Mary Felzkowski of Tomahawk is the incumbent candidate for the 12th Senate District. The election is November 5th. Senator Felzkowski, welcome to WisconsinEye.
Well, thank you for having me, Lisa.
So tell me, what is your campaign's key message? Why are you running for re-election?
So I think the reason I'm running for re-election is the reason that I ran in the first place. I love northern Wisconsin, and I want to make sure that northern Wisconsin is a place that people can live, work, raise a family, and have opportunity. And as time has gone on, I see that opportunity is shrinking in northern Wisconsin. And it's harder and harder to raise a family there and find ample opportunity for good-paying jobs. And I want to change that. I want to make sure that no matter what that zip code is, there's good-paying jobs, opportunity for our schools, and good public schools, private schools, whatever that parent, wherever they want to send, charter schools, good access to health care, and it's a good place for seniors, young people, people of all ages.
So if you're reelected, what's an example of a bill that's a priority for you to introduce?
So there's numerous ones. We have a full health care package, access, number one, hospital price transparency, PBM reform, WIO, all-payer claims database, insurance price transparency. That's my health care. On the other side, we're working around water quality standards, PFAS cleanup bills. Those are another package of bills around water quality that we're working on, and the list goes on.
So as you know, if you're reelected to the Senate, it's a biennial budget year, the state, new projections, $4 billion surplus. Mm-hmm. What would be your top two priorities for use of the surplus funding?
So I think what we're going to do is what we did last time around. So with that surplus, I always want to return surplus back to the taxpayers, because if we have a surplus of that magnitude, it means we're taking too much out of people's pockets.
So who are the people that would receive a tax refund or be part of tax reform in your platform?
In my platform, I think everybody should get some money back, because whoever's paying in should receive that money back. We tried doing that in the last budget, and Governor Evers pretty much said no to everything we tried. So in the last round of tax refunds, we said, Governor Evers had always said that middle income is up to $150,000. Those were his words. So our last tax cuts were people up to $150,000, and he even said no to that. So I would be open to sitting down to the governor and saying, okay, who can we refund to? If this is part of the one-time dollars, the surplus, then we should do what we did last time around again. If it's one-time money left over from a lot of the ARPA and things like that, then let's use one-time dollars for one-time investments like we did last time around. Building maintenance, road maintenance. Instead of bonding and borrowing, we can use it for infrastructure, building maintenance, road maintenance, and we would use one-time dollars for that.
What about K-12 education? You mentioned that as an overall priority. What things need to change in K-12 education, do you think, and what are your interests this time around?
I think K-12 education, we need to take a hard look at why, when we look at K-12 education, and I've sat down, I have a great relationship with my CSAs. I want to talk to the CSAs. I have a monthly meeting or bi-monthly meeting with WisconsinEye, and they have great ideas in WisconsinEye on how do we get more people in education and how we get more teachers in education. We need to start listening to boots on the ground people and taking their ideas. And when it comes to funding K-12 education, I want to listen to the parents. Where do parents want their children to go to school? Public, private, charter, independent? Some parents want to homeschool. Let's start listening to our parents and seeing what do our parents want.
Do you support a big increase for public K-12 education this time around, or what does the funding look like to you?
We need to look at what is our revenue. You know, what is the revenue stream that's going to be coming in? Because we're going to have a lot of needs out there. What is our Medicaid budget going to look at? What's the continuing there? I'm hearing around $800 million on that as a cost to continue. What are we going to have for dollars? And then we're going to have to take a look and see where do those dollars need to go.
What about higher education for your colleges, two-year colleges, technical colleges? What does the future of that system look like to you, and where do you think the legislature should focus?
So I think the president of the system has some great ideas.
And a big ask.
He does. He does. And again, it's a balancing act. What are the dollars coming in from the state? And then where do those dollars need to be spent? And I think there's a lot of needs out there. You know, President Rothman has taken a real hard look at the 2 years and the 4 years. Do we need 2 years? And I think that only our education people can take a real hard look at that and say, yes, we still need 2 years, maybe in certain areas. Or can our technical college system start taking a look and picking up a lot of that? And then let's look at what the needs are. Do we, you know, if we have a 2-year that has lost 80% of their students, maybe it's time for those 2 years to close. I don't know the answer to that.
It sounds like you still need more information on whether or not you would support President Rothman's proposal.
Yep.
What do you see as the state's largest workforce development challenge, and how would you address it?
We need people in the workforce. You know, I think we still have some people that are sitting on the sidelines that can re-enter that workforce, and we need to help encourage them to do that. And then we need to bring people into the state. And how do we do that? How do we get young professionals back into this state? You know, I have children in their 30s, and I talk to them a lot. What would bring them back into this state and their friends? And it's interesting. My son has some friends that have just returned, that have just moved from Illinois into this state to work because of the opportunity that was here for them. And I think we need to look at why would young people come into this state, young professionals to work? And then why would laborers, operating engineers, what would bring them into the state to fill that workforce?
You're not sure yet what that
I don't
might
know
look
what
like?
that would be.
But you're open to providing some incentives?
Oh, absolutely. Absolutely.
A few more workforce questions for you. Investments in public and energy infrastructure grow our state's economy. This also provides an opportunity to invest in the state's workforce, but currently there are no requirements for hiring local workers. Would you support a state resident hiring requirement for state, local, and utility scale infrastructure investments?
I think that I like the idea of hiring our local people first, but do we have enough people to hire local? You know, I don't want to put a mandate on only hiring Wisconsin workers if we have a worker shortage.
So we have to fix that problem?
It's, you know, I don't want to create a whack-a-mole problem. So we're going to say we're only going to hire Wisconsin utility workers. If we have a worker shortage, what are we doing then? You know, this is a thing where I would rather have that conversation with our labor market and say, if we put this in place, that's great, but do you have the labor force to do this?
Another workforce question, employee classification is an issue in the construction industry. Some employers misclassify workers as independent contractors or pay them in cash off the books. This lowers costs by avoiding payroll taxes and unemployment insurance and puts compliant companies at a disadvantage when bidding on projects. Plus, those misclassified workers may be denied minimum wage protections or overtime pay. Are you aware of the issue, and what do you think should be done about it?
That's a tough one. So I am an independent insurance agent, and I see this happening all the time. It's kind of a federal IRS issue. Those laws are already in place, okay? That the IRS says in order to be classified as an independent contractor, and they already have all those laws in place, they just need to start enforcing them.
They meaning the state?
Yeah, the state or the federal government.
Not necessarily a role for the legislature in fixing that?
The laws are there. It's an enforcement issue.
Moving on to housing. Affordable rental housing is an issue in Wisconsin. Some support government-imposed rent control to maintain affordability, while others argue keeping rent artificially low will decrease rental supply, resulting in increased prices. What is your sense of housing as an issue, and which best addresses rental housing affordability? Is it rent control, building more rentals, or some other solution?
You know, last budget we put $500 million out there, and I'm starting to see the fruition of that. I think we need to give it a little bit of time. I'll use Tomahawk, my hometown, as an example. We are now seeing housing starting to be built. Low housing, and it's entry-level housing plans. So contractors are now starting to take advantage of the plan that we put in place in the last cycle. So I don't want to start putting housing controls and rental controls in place. I want to give, you know, it was only 2 years ago what we passed in the budget. And we're seeing 64 units going up in Tomahawk that's going to start next spring. And we saw 7 to 10 homes. Now, I know that's not huge, but for a town like Tomahawk, 3,200, you know, it's the contractors are building them. So let's give this a chance to take effect, what we just passed, without going down a different path. And if this is starting to work, let's build on what's working.
Healthcare. Medical systems are facing numerous headwinds in the form of inflation, workforce development, and issues around Medicare and Medicaid reimbursement, resulting in fewer services and, as you know, even the closure of a hospital system in western Wisconsin. What would you do to preserve access to care and prevent future closures?
Oh, that's a huge... So I look at healthcare as this huge onion, okay? And the challenges that we have in healthcare are challenges that have developed over 30 years. I think we have a very broken system, and it's not going to be fixed overnight. And it's one of these things where we're going to have to start fixing it and peeling it back. I look at hospital price transparency as the number one thing that we need to do. So first, 80% of the lives in the state of Wisconsin right now are on ERISA plans, meaning self-funded plans. We need to give employers the tools to build out plans with the lowest costs that they can and the highest quality that they can. And that is going to allow them to start lowering their costs with the best quality of care. If you're out and about and you're talking to constituents, and I do this all the time, I've been all over the state talking to constituents on the doors, people are not going to the doctor, and they're not afraid of the results. They're afraid of the costs, and they're afraid of medical bankruptcy. That is a very scary thing. And then when they do go to the doctor, their situations and their health care or their diagnosis is escalated, which is also driving up the cost because we're not catching things early. I also understand that hospitals are facing higher costs and a workforce shortage. Let's get their costs down. And I'm very disappointed in my hospital partners for fighting transparency. Why do you not want people to know what their costs are going to be up front? Let's get transparency in costs so people know. Hospital price transparency was first passed in Colorado. It's a federal law, but hospitals fought it at the federal level. They lost. CMS is not doing a very good job of enforcing it. Colorado passed it 2 or 3 years ago. It's now in force, and we're starting to see the effects of it, and it's positive. Texas passed it, Virginia, Ohio. Let's get it done in Wisconsin. Let's get insurance price transparency so consumers know, employers know.
What about, do you support increasing the Medicaid reimbursement rate to hospitals this time around?
We did last session. We did it very largely. If hospitals want that, then come to the table. You be transparent for my constituents and my employers, and let's have that conversation. I'm not saying that they don't need that, but you could give a little bit here, and we'll give a little bit here. If you want more money, you give my constituents the ability to know what they're going to pay up front. You tell me, what else do you buy that you don't know the price of, Lisa?
What about mental health care, Senator? It's a growing concern for many Wisconsinites, a concern for state and county budgets. What are you hearing on mental health care, and what are some solutions?
The biggest challenge we have on mental health care is providers. I would love to throw hundreds of millions of dollars at mental health, but who's going to provide it? So in the last budget, we worked greatly with the Medical College of Wisconsin. They have a program out there where we put more money into actually developing providers and training providers. And they also have a program. I actually had one of my constituents come in. She lives in Gleason, which is a very small town, but what she does is she works with doctors. So if you are a family doctor in Tomahawk, you have a hotline to her. So if you have a patient come in who you know is suffering from mental health and you are not trained in mental health, you call her. And then you as a general practitioner can work with her. Now, no, it's not the same as having a psychiatrist that you're working with, but it's a way to take her knowledge and use it to the best of your advantage to help someone and help prescribe.
What more can the state do in that area?
So we are putting money and helping the Medical College of Wisconsin train more providers. And that's what we need to do. And we need to incentivize young people to go into the provider realm. And we just need to keep that pipeline and building that pipeline. And we've done that with the Medical College of Wisconsin. In central Wisconsin, they have a pipeline where they're training more mental health providers. But this is something, it's a nationwide crisis. We need to train providers because we can keep putting money into mental health, but if there's no one to deliver,
the problem continues. How should Wisconsin move forward on the issue of abortion?
That is the toughest question in the whole wide world. I agree with Senator Ron Johnson, and I agree with our candidate, Eric Hovde. I think the people need to vote on this.
Put it to referendum?
Yes.
Do you support a number of weeks as a limit personally?
So last session, I worked with the Assembly, and we put out a bill that gave exceptions for life and health of the mother, rape and incest, and then a 14-week post-gestational, because it seems, you know, and I'm going to talk about this sterile, and I don't want it to sound sterile because it shouldn't be sterile. After Roe v. Wade was overturned, Pew, nonpartisan Pew, did a study, a survey, and it seems that most people fell right in that first trimester. And then the Assembly does a spring survey all the time, and when they compiled their spring survey, 12 weeks seemed to be, that first trimester seemed to be the number that most people that responded to the Assembly survey was comfortable with. And life and health of the mother and rape and incest for exceptions. So we put out a piece of legislation that said, it's called contingent liability legislation because Wisconsin doesn't have a referendum ballot initiative. So it would pass the Assembly, it would pass the Senate, the governor would have to sign it, and it would have been on the spring ballot. And then Wisconsinites could have said, yes, you got it right, or no, you did not.
That's what you think is the way to go forward?
Yes, so it passed the Assembly. Our Senate president killed the bill. So it never went to the voters. And I think that was wrong. I think this is because Wisconsinites are all over the board on this. Europe, most European countries are at that 12 weeks with exceptions for life health of the mother. No woman should ever have to question whether her life is at risk.
I need to move you on to another important issue, transportation. You mentioned roads in your earlier answer. What are the pressing transportation needs in your district, and how should the state balance that and keep on schedule with reconstruction of aging interstates and corridors of commerce?
It seems like wherever I go, there's road construction. We've done, and we're investing in the large majors. What DOT has brought to us with the megas and the large majors, I mean, go 41, 43, it's just everything I seem to travel on, running around the state helping candidates, is under construction. So I think we're very up to date on those needs. And we've done the big majors in southeast Wisconsin. Now we put additional money into LRIP and then LRIP-S. And now we started a new program, which is ARIP, which is the agricultural based. And it came to me Senator Howard Markline, this was his brainchild because he has a lot of agricultural land. And I said, sorry, Howard, can't support it. He goes, why, Mary? I go, add logging to it and I'll support it. He goes, absolutely, we can do that. So then I'm like, you got my vote. And it has been amazing for my district. My counties have really dove in and my towns and applied for that.
Do you want to make that permanent?
If we have the dollars, I would absolutely make that permanent. And the big caveat to that is it's a lower match for my counties and my townships. So it's only, I think it's a 10% match instead of the 50-50 match. And we are seeing it really take off. And here's the thing, and I want us to always think about this. It's great to just throw money. Just remember, we have to have the people to do the work.
Right. What about PFAS? You now have that in your district.
I have a lot of PFAS in my district. I always have, because remember, I have the town of Stella.
How should we be addressing PFAS?
PFAS is the new PCBs. Remember back in the 70s and 80s, we had PCB. Forever chemical. So I don't want people to think that PFAS can never be addressed, because as we have dealt with PFAS, we've had a lot of people come into our office and talk to us and discuss this. Yes, we can call it a forever chemical, but just remember, technology moves forward. And there is now new technology coming out where we will be able to deal with PFAS, change the composition of it. I believe in technology. We're very innovative in this country.
Do communities need funding to invest
Absolutely. In? First, we need to test, and then we need to do the cleanup on it. This will be billions, if not trillions of dollars in the United States to deal with the PFAS issue.
Is that a priority for the state to invest in that?
It has to be. It has to be. This will be public-private cleanup. I was not involved in the drafting of the bill that was introduced by the legislature. I was in conversations about it as Senator Wimberger and Senator Coles drafted the bill.
You support some changes to that bill?
I support getting something done.
I have to move you to our final two questions. How would you describe the leading differences between you and your opponent?
Well, I don't know my opponent. I would just say, having seen what she has put out against me, my opponent is doing straight Dem talking points. She put out things, when I put out hospital price transparency, she put out straight hospital talking points. The minute I mentioned that Colorado passed it and the Democratic governor championed it, she automatically took it down. So I don't think she's really invested in she's just doing straight talking points. I've lived and worked in northern Wisconsin my entire life. I own a small business. I have children. I'm a grandparent. I want a better tomorrow for my kids and my grandkids. I've signed the front of a check as well as I signed the back of a check. I want to make sure that the opportunities I had growing up are the opportunities that I leave in northern Wisconsin for everybody that comes forward.
Final question for you. We started before the interview, we were talking about the partisan divide. If you are reelected, you get a magic wand, and you can resolve one issue in a way that brings all parties and people together. What do you think that issue is that brings people together?
Opportunities. I have talked to some of the most conservative, let's just put it out there, mega Trump people in my district, because my district is very, very, very conservative and very Trump country. They're tired of it too. They want us to make Wisconsin a place for everybody. Let's work together. All right. And that's what I want.
Senator Mary Felzkowski, the Republican incumbent candidate from Tomahawk in the 12th Senate District. Senator Felzkowski, thank you for talking with WisconsinEye.
Thank you.
This programming is brought to you by our generous sponsors. Thank you for watching.